Hi, I'm Dr. Matson. Today we're going to be talking about population health for nurses. We're following the OpenStax textbook and we're covering Chapter 5, Demographic Trends and Societal Changes. So as an overview, we're going to talk about demographic factors, healthcare consumer behavior, virtual care and technology, and healthcare workplace. For your learning outcomes, by the end of this section, you should be able to define demographics and describe the fastest growing demographic in the US and describe characteristics of underrepresented populations and examine how projected population changes challenge public health policy and implications for healthcare services. When we talk about demographics, we're referring to the statistical data about characteristics of people living within a certain place. So populations are often described as factors such as age, race, ethnicity, education, income levels, and marital status, for example. So these categories help us understand the makeup of a community. And it's important to remember that individuals can belong to multiple demographic groups within a population. So by looking at these, we can think about what kind of services are most relevant and where gaps exist in these services. In terms of the fastest growing demographics, so according to the US Census Bureau, in the US, there's a significant demographic shift that's forecasted for the next 40 years. So when we look at baby boomers, and these are those who are born from 1946 to 1964, until recently, they were the largest generation in the United States. So as they reach age 65, their numbers raise the percentage of the total population over 65. So in 2020, 16% of the total population is over 65, but then we look at this in 2060, that's 25% is projected to be over 65. And what that means is that we're thinking about those who are considered older adults, they can have a higher incidence of disease and need for healthcare services. So as public health nurses, we need to be thinking about what strategies can be implemented now to anticipate those needs. In terms of racial and ethnic minorities, the percentage of racial and ethnic minorities is forecasted to grow. So individuals who identify as two or more races will be the fastest growing racial or ethnic group in the United States. So demographic changes will impact the prevalence of disease and disparity as those have an impact. And then we want to think about what this means for healthcare professionals. So are we aggregating data and looking at those changes and anticipating healthcare interventions? So people in underrepresented populations are more likely to develop chronic conditions and need medical attention for those conditions. And so we have to then think about what that means for the healthcare system. And again, we're trying to anticipate what we can do in a preventative way. So when we're thinking about vulnerable populations, we want to start to consider what barriers to social, economic, political, and environmental resources are there and what that means in terms of risk for poor health. So vulnerable populations tend to experience health issues that could be preventable if there were other interventions in place like accessible health care. So individuals who experience poverty are at risk for poor health and poor health outcomes. One reason is this lack of healthcare access. And then when we think about the poverty level, it increased from 10.5% in 2019 to 11.9% in 2020. So we want to be able to track that and see if that poverty level is going up and what that means in terms of healthcare services. So other groups may experience negative outcomes because of discrimination and stigma. And so again, we want to be thinking, what can we do as public health nurses to help put strategies in place in the community for health promotion, disease prevention lens. And then people with disabilities also make up another potentially vulnerable demographic group. And we want to consider this when we're doing our community health needs assessments. So the need for policy change. So we want to think about how everyone can get an opportunity to the highest and achieve their highest level of health, and what that means in terms of strategy. So what goals are there, what programs and structures are in place to help improve healthcare access and intervention to those who need it. So now we're going to be looking at healthcare consumer behavior. So you want to be thinking about the availability of healthcare services and the confidence that people have in the healthcare system and how that influences their use of healthcare. And then also think about cost of healthcare services and how this also impacts use of care. So, who is a healthcare consumer? This would be a person who uses healthcare services, whether they pay for those directly or it's through a third party. And then factors that determine healthcare consumption can be, for example, availability of the services, how confident they are in those services, and how much do those services cost. When we're talking about the availability of healthcare services, this is dependent on where someone lives and if they have even those resources in that area. So we can think about rural health and their shortages they have there. Maybe there's only one hospital, only maybe one or two OBGYNs, maybe they don't have midwives in that area. So you want to think about the specific area and then their who the healthcare provider and structure is and how that's impacting then what they're able to access and potentially what health outcomes are there. We can also think of mental health services. These have barriers, availability, and cost. And there's also if there's a stigma and discrimination preventing people to access it, or even that fear where we talked about how consumers how they feel about it. So how does a patient, are they afraid that whatever they're going to say in a mental health session with therapists would then be in their EHR and impact other things. So we want to be able to address that as a public health nurse. So we're talking about confidence, right? Trust. So people may lack confidence in healthcare providers and system, and those that distrust the system will avoid going to it when they need it for care. And they may not feel like they can communicate effectively with the providers. And this could be because of differences in culture or language. Additionally, people may fear unethical research practices because of things that have happened historically. And there can also be vaccine hesitancy because of this lack of trust. In terms of healthcare cost and consumer behavior, we have to think about cost of insurance and prescription drugs, cost of delaying care, and cost of disease. So if people have a lack of access, they may go straight to the emergency department, or if they have it set up, if they have to go to a primary healthcare provider first and they haven't established that and they don't know who to go to, they can't communicate with the provider, they might end up in the emergency care department. So all of these different pieces impact how people use the healthcare system, and then that also impacts their health outcome ultimately. Okay, so now we're going to talk about virtual care and technology, and you want to be thinking and asking yourself what the key terms are and how that impacts care, and then what advances are happening that can maybe be a cost-effective solution, and then thinking about the implications for technology and quality and safety of care. So telehealth has really grown in the past 20 years, and this also includes things like home monitoring and the EHR. And these innovations have impacted cost and quality of care and safety of care. So telehealth, we're thinking about digital information communication that can help enable remote access to healthcare services and providers. And this can be beneficial for those who have, let's say, childcare constraints and employment constraints. Maybe they are in a rural health area, so the distance is far for them to travel. So telehealth has really resulted in cost saving for patients and insurers. And the downside could be that it can't be used for every visit. There is some risk of data being breached, and it might not be covered by insurance for every type of visit. And some require that you have established care and that you come in first to the provider before you are able to have a telehealth visit. For the electronic health records, this enables recording, tracking, and maintaining patient information in the record. We can see in there's a problem list, demographics, medication, assessments, history, and care plans. This really impacts safety and quality of care because it can reduce medical errors if used correctly. It can help provide facilitation between patients and providers, but it also is a big time constraint, and can be tedious for those that are using it. On a research end, the data from this EHR can be used and analyzed then to look at health problems that are prevalent to one area or overall, and to start to train models that can help predict disease and can be used to identify patterns of disease. When we talk about home monitoring, this is where patients use devices like home blood pressure monitors. These can be linked even to the EMR or provider's office. And then mobile applications can be used to collect data like heart rate, and that can be transmitted to providers. So using this with telehealth really can allow for continuous monitoring of chronic diseases like high blood pressure, diabetes, heart disease, and obesity. And then hopefully this will also have a big impact to improve health outcomes and can be cost saving for both patients and healthcare facilities. Now we're going to talk about healthcare workforce. So we're going to think about workforce shortages, the impact of COVID-19, the representation of the healthcare workforce, and looking at the aging and impact of the nursing workforce. So in approximately 4.3 million registered nurses are working in the United States, and this is according to the American Nurses Association. But according to the American Hospital Association, between 2019 and 2020, in the healthcare workforce, there became a vacancy of 30%. When we look at COVID-19, 6 in 10 healthcare workers said that they had stress from the pandemic, which impacted their mental health. And then these findings were also confirmed by another study by the American Nursing Organization for Nurse Leadership. The effects of the registered nursing shortage, these projections mean that there are really some negative effects, and it is alarming. The nursing shortage is larger than any other healthcare profession, with more than 275,000 additional nurses that are deemed to be needed from 2020 to 2030. And wages have risen, so it's harder to compete for these qualified nurse applicants. And there's a strain, this financial strain, because it takes quite a bit of money for the hospital systems to onboard new grad nurses as well and train. So they have to put them in cohorts, which means that even though there might be people entering into the profession, there's still a delay in them being able to work fully on the floors that need them. In terms of the makeup of the workforce, 90% of nurses worldwide are female. And the majority of organizations have said that the workforce, it benefits the workforce to have diversity, and that this helps connect with the patients who are on the floor. So there has been efforts in that regard. And then in summary, we're looking at these demographic factors and seeing how the changes in the United States and structures are impacting the healthcare systems and now and then in the future, looking at healthcare consumer behavior in order to better understand patients, populations, and their needs and tailor those healthcare interventions to those groups. And then this use of virtual care and technology, where the innovation gap is, just be thinking about what the next step is and how healthcare will be changing in these years to come, in addition to the changing the needs and the change that hopefully will be seen also in the healthcare workforce.